High blood pressure, or hypertension, is often called the silent killer. And there's a good reason for that. Millions of people around the world are living with high blood pressure and don't even know it, because it doesn't always come with obvious symptoms. Over time, though, uncontrolled hypertension can damage your heart, kidneys, eyes, and even your brain, leading to life-threatening problems like heart attacks and strokes. That's why it's so important to recognize the hidden signs of hypertension you shouldn't ignore. Today, we're going to talk about those subtle clues your body might be giving you, so you can catch high blood pressure early and take action before it's too late. Let's start by remembering what high blood pressure actually is. Your blood pressure measures the force of blood pushing against the walls of your arteries as your heart pumps. When that force is consistently too high, it puts strain on your arteries and your heart. Normal blood pressure is around 120/80. Anything consistently above 130/80 is considered elevated, and if it stays high, that's when the damage begins. One of the first hidden signs of hypertension is frequent headaches, especially in the morning. While not everyone with high blood pressure gets headaches, some people do. These headaches often feel like a tight band around your head or a pounding sensation at the back of your skull. If you're experiencing headaches regularly, especially when you wake up, it's worth checking your blood pressure to rule out hypertension. Another subtle sign is dizziness or feeling lightheaded. Occasional dizziness can happen for many reasons, but if it happens often, especially when standing up or during normal activities, it might be a sign that your blood pressure is fluctuating or consistently high. Dizziness linked to hypertension can also increase your risk of falls and injuries, so it's not something to dismiss. Vision problems are another warning sign. High blood pressure can damage the small blood vessels in your eyes, leading to blurred vision, seeing spots, or difficulty focusing. In severe cases, it can even cause bleeding in the retina, known as hypertensive retinopathy. If you've noticed your vision changing, especially alongside other subtle symptoms, it could be your body telling you something important about your blood pressure. Ringing in the ears, or tinnitus, is another symptom that many people don't associate with hypertension. While tinnitus can have several causes, high blood pressure can make the ringing louder or more noticeable because of the extra force of blood pumping through the vessels near your ears. If you're hearing ringing or buzzing often, it may be time to check your blood pressure. Chest pain or pressure is a more serious warning sign. High blood pressure forces your heart to work harder, which can lead to angina or chest pain, caused by reduced blood flow to the heart muscle. If you ever experience chest pain, don't ignore it. It's a medical emergency that needs immediate attention, as it could indicate a heart attack or severe hypertension. Another hidden sign is shortness of breath. When your blood pressure is high, your heart struggles to pump efficiently, and this can cause fluid buildup in your lungs. That makes you feel like you can't catch your breath, especially when climbing stairs or doing simple activities. If you often feel winded after light exertion, it's time to take your blood pressure seriously. Nosebleeds are also sometimes linked to hypertension. While most nosebleeds are harmless and caused by dry air or irritation, frequent or unexplained nosebleeds can sometimes be associated with very high blood pressure levels. This is especially true if nosebleeds occur along with headaches or dizziness. Fatigue and confusion are more subtle signs that are often overlooked. When your blood pressure is uncontrolled, it reduces the amount of oxygen and nutrients reaching your brain and muscles. This can leave you feeling unusually tired, mentally foggy, or unable to concentrate. Some people even mistake these symptoms for stress or lack of sleep, when in fact their blood pressure is the root cause. High blood pressure can also silently damage your kidneys over time, leading to swelling in your hands, feet, or ankles. If you notice your rings feeling tighter or your shoes fitting differently due to swelling, that could be another hidden clue pointing toward hypertension. Another hidden warning sign is irregular heartbeat, or palpitations. High blood pressure puts strain on your heart's electrical system, sometimes causing your heart to beat too fast, too slow, or irregularly. While occasional skipped beats are common and usually harmless, frequent palpitations combined with high blood pressure can increase the risk of stroke or heart failure. It's also worth mentioning sleep problems, like snoring or sleep apnea. People with obstructive sleep apnea often have higher risks of hypertension because the pauses in breathing put stress on the cardiovascular system. If your partner notices you snore loudly or stop breathing in your sleep, it's not just a sleep issue, it may also be tied to high blood pressure. Now, it's important to remember that many of these signs, Headaches, fatigue, vision changes can be caused by other conditions, too. That's what makes hypertension so tricky. You might not realize your blood pressure is high until you measure it. That's why regular blood pressure checks are essential, even if you feel fine. Don't wait for symptoms to appear before you take action. So what should you do if you suspect high blood pressure? The first step is to monitor it regularly. Home blood pressure monitors are widely available and easy to use. Keeping track of your numbers gives you valuable information to share with your doctor. If your readings are consistently above 130/80, it's time to take it seriously. Lifestyle changes can make a huge difference. Reducing salt, eating more fruits and vegetables, exercising regularly, avoiding smoking, limiting alcohol, and managing stress are all proven ways to lower blood pressure naturally. But for some people, lifestyle changes alone may not be enough, and medications might be necessary. The important thing is not to ignore the warning signs or assume everything is fine just because you don't feel sick. Hypertension is dangerous precisely because it can damage your organs silently for years. By paying attention to subtle clues like frequent headaches, dizziness, vision problems, fatigue, swelling, or irregular heartbeat, you can catch it earlier and prevent serious complications. So, don't ignore the hidden signs of hypertension. Be proactive with your health, get your blood pressure checked regularly, and make healthy choices that support your heart and your body. The earlier you act, the better your chances of avoiding the silent but deadly effects of high blood pressure. If you found this video helpful, make sure to give it a thumbs up, share it with friends or family, and subscribe for more videos on health and nutrition. Remember, knowledge is power, and paying attention to your body today could save your life tomorrow.